Hi.
Hi.
Dr. Cox. So, what brings you to us today?
Pain, gallbladder.
Okay. How long have you had that pain?
About 4 months, maybe a year.
4 months. Okay. And what's it feel like?
It hurts a lot.
What are you concerned
Pain.
She's very good.
It's a lot of pain.
about? And it's right there, right where that gallbladder lays.
I guess. Just, I don't know, it hurts a lot.
Okay. Have you seen anyone else for this?
My primary care physician.
Okay, that sounds great.
Clinical empathy is being able to listen. Clinical empathy is the ability to be empathetic with a patient and or their family in a clinical setting with the goal of increasing positive medical outcomes. These are the things that we talked about last time. Active listening, which is listening to the person as a person rather than as a set of problems that need to be fixed. Expressing empathy, expressing that in a way that can be seen and heard, reading body language, being able to understand the subtle things. It's a misconception that we just teach empathy. In fact, empathy is one of them, and it's one of the things that we teach. We teach communication skills, the ability to be present, to be in the moment with another human being. Communication is central to the practice of medicine. This has been known for a very long time, and numerous studies have shown that doctors who are able to communicate well with patients and their families are able to make better diagnoses in less time, are able to come up with more effective treatment plans, are able to interact with the patient in a way that ensures patient follow-up, successful patient follow-up, and have better successful outcomes, have a better rate of successful outcomes. One of the most significant things that makes patients better is whether or not somebody cares, is whether or not they believe somebody cares about them. If you take all the studies, and they've done huge studies where they've tried to isolate the most significant causes, and it turns out that whether or not the patient believes that somebody cared about them, somebody in the medical staff cared about them, was one of the most significant factors in whether they got better.
What we really work on here is we work on using our voice so that we demonstrate and we truly can sort of embody a caring sort of vocal sound to it, a tonal quality to it, so that it sounds like we really care. We're not acting. This is just being real. It's being honest. It's showing genuine care and concern for the feelings of the patient and their families.
We are not teaching doctors to act. We are teaching doctors skill-based ways to understand the interaction of one person with another. Ready? Go. Okay. Now, say it in a way that makes me think you believe it. Okay. What quality will your patients value in you? Speak it out loud. Okay. If I were your patient right now, we are unique in the fact that what we've done is we've taken a proven, validated curriculum for teaching those skills, and we are using essentially cross-disciplinary work and applying proven skill-based training in medicine. So we're taking theater skills and using them in medicine. We are unique in that respect.
It is so unique that the national press is just off the charts. We've easily, within the last 6 or 7 months, have had over 100 publications, journals, newsletters that have talked about this or done stories on us, and that's nationwide.
Now, I think that it's very important that if one of your friends' mother had passed, the first thing that you wouldn't do was try and you wouldn't go into nurse mode. You wouldn't be thinking that there were certain things that you were supposed to be asking. For that 1 second, you would just be there with that person. Yes? Mm-hmm. Is that, can you do that as a nurse? Mm-hmm. Just be there for that person for a second. Let them know that, I'm sorry to hear that. Is that fine?
Yes.
Is there any reason you wouldn't do that?
No.
Well, to a certain extent, you do go into nurse mode, anyone, because the first thing you want to do if your friend is freaking out and having an anxiety attack is you want to calm them down. Mm-hmm. And so you're like, you just say, just calm down, you know, I can't understand what you're saying, you know, calm down, you know, tell me what's wrong, you know, get them tissues, water. You know, first thing you want to do is make sure they're okay.
Mm-hmm.
So to a certain extent, it is.
Absolutely.
Remember we said the average rate of speech for most Americans is 125 words per minute. So therefore...
Stop. Therefore what? If we speak at 125 words per minute, you're thinking very, very fast. And what's happening is your brain needs to do something. It's racing ahead. So in order to build rapport, in order to listen actively, one of the things you need to do is figure out how to occupy your brain in a way that is productive and connective with the other person.
One of you is going to be the listener, and the other one decide who is going to take the part of the patient, or it may be the nurse. And we would like you to listen to the conversation, and when they're through, make a human connection, exactly like we talked about here. Remember, we said one thing is just active listening is important, but it's reflecting something back to them so that they know they've been heard. Okay?
So let's not forget, you're actually trying to listen for what's underlying those words. What is underlying her words that you're trying to kill her? Trust. She doesn't trust you. Now, don't you think that's more important at this moment? As your job then is to try and figure out how to make her trust you.
That's what she said with the kid.
Can you just go get me a little medicine for me?
What kind of medicine?
So even that, right away, just
Crack, just a little bit. I'm sorry, Miss Moreno, we can't get you any crack. Can I get you anything else? Like why? Why can't you get me crack?
Because we can't supply you with that, but I can get you something to eat, something to drink. Are you okay? You comfortable?
Can I just point something out? That what you're doing right now? What you're doing subconsciously, you're making a human connection, literally, with your touch, which is much more powerful than any word you say.
David!
yes.
Okay, we're gonna have to talk about something.
Mm-hmm. Yes.
This type of behavior that you are exhibiting right now is not gonna fly for the rest of the day, or anything else. Why are you doing this?
Because I want to.
Well, how do you feel about restraints?
Would you want this too?
Okay. No, I don't want them.
Okay, well then let's compromise, maybe, and you quit being so, you know, overactive, and we can stop. Stop it.
In the theater, there's a misconception about theater as well, that we teach people to be larger than life, that we teach them to be grandiose, that we teach them to perform or present information. In fact, training in the theater is designed to teach people to be alive to the realities of a moment within a fictitious world, which means that you have to be even more cognizant of the types of interactions, of the types of impulses that are there in the moment.
Aaron, how are you today?
I'm fine.
Yeah, good to see you.
Yeah, good. I'm fine. Ready?
How are you today, Aaron?
Fine.
I'm really happy to see you.
So, for instance, the reading of body language seems like a very, to most people outside of my work, outside of the profession of theater, reading body language seems like a very fuzzy sort of thing. Like you kind of tell, or there's even the word, well, there's kind of, this person had a vibe about them. Well, how do you measure a vibe? Well, in theater, we can measure that sort of specifically. We can break down exactly where was the eye, where were the hands, where was the body, was there a relaxation, how was the breath, what's that person's relationship to space, what are their thought processes. Presence, the concept of presence are skills that we teach, and there are a number of techniques that we use. Some of the techniques that we use to teach actors are inappropriate for doctors, but some of the techniques that we use are absolutely directly applicable to medicine.
This is how a woman animates her face, okay? Happy, sad, angry, fearful, desire.